I think we just want to assure people that, Ortho-K has been around for a very long time. It's been in my practice. We've been going for over 20 years, and I can tell you that it was in Australia probably a decade before that. So I just want people to trust that it has been around a long time. It's not a new thing. And while healthy skepticism is good, trust that it's not too good to be true. It is a genuine, bona fide treatment that's available to lots of people, particularly in first world countries like Australia.
Do you wear glasses? Do you ever feel like they limit you in some ways? Have you considered traditional contact lenses but decided that they just aren't for you? If so, is laser eye surgery the next best option? Well, stick around because in this video, you're going to learn about another choice that involves no surgery and will help you regain good vision without glasses, even if you found contact lenses to be challenging in the past. I'm talking about orthokeratology, also known as Ortho-K. And to help us understand this popular vision correction approach, I'm talking again with Paul Graham. Paul's a leading Gold Coast optometrist with over 30 years of experience. He's also the owner of Harmony Vision Care at Varsity Lakes. But who am I? My name's Paul Salloway. I'm the owner of Optics Digital Marketing. We're an agency that helps independent eye care practitioners to grow their clinic. Hello, Paul. Good to see you again.
Yeah, good morning. How are you?
Very well, thanks. Very well. So we'll get into all the benefits of Ortho-K shortly. But before that, I just want to ask you, we live in a very sort of skeptical age where people are wary of big promises. And I think Australians probably in general, we have a pretty good filter for that, for promises.
Yeah.
Do you find that becomes a problem sometimes actually explaining to people that Ortho-K is such a great option? Because the more I hear about it, the more I like it. But I think maybe some people are just maybe they might think it sounds too good to be true.
Yeah, and I think that's there's some inbuilt sort of skepticism, and that's not a bad thing. And I think Australians typically shy of anything that's sort of a bit overstated. And it's interesting because we started Ortho-K on the coast over 20 years ago. We were the first practice doing it on a regular basis. And I've just seen one of my first patients who started the Ortho-K journey with me, and he's still wearing them to this day, and he's now oh, I think he's about to turn 60, and he works in real estate, and so he's not shy on talking to people about things and marketing and all the rest of it. And he said, Paul, I've been telling people for 20 years. And he said, it's great, but he said it almost comes across too good to be true. And I think the big challenge we've got in Australia is that, health industries are highly regulated. And so testimonials is something that we're not allowed to use. And we understand the reasons why, but it just does mean when you've got something like this, it's difficult to share other people's experiences with it.
Yeah. And you've tried Ortho-K yourself, haven't you?
Yeah. And in fact, that's what got me kickstarted. A friend and a colleague of mine, we opened up our practices at a similar time. In fact, no, he opened his up, had it for a year or two while I was considering going out on my own, and he'd introduced Ortho-K into his practice, and he fitted me with it. And I'd known about it since university, but just it's one of those types of things that is such a specialty that it's hard to convince your employers to do it. You've got to sort of almost go out on your own to make a start. And
Yep.
certainly equipment back then was much more expensive than it is now. Anyway, so I tried it and went, oh, I wish I'd done this 10 years ago myself. And of course, having that personal experience meant that, and just I enjoy fitting it too. So there's the personal benefits of having lived it, but also just I really enjoy the process of helping people see better through Ortho-K.
So you eat your own dog food, as they say in business.
As they say, yeah.
All
So
right.
I'm 20 years into having worn them. So, I've, yeah.
Well, so I think many people have heard about LASIK, and now there are other types of eye surgical techniques as well, but LASIK is probably the one that's most well known. So why is Ortho-K a good alternative to laser eye surgery?
Well, if the basis is trying to reduce your reliance on glasses during the day, and obviously, LASIK, it's a more permanent kind of change. the principles of how you reduce someone's myopic correction so that they can go about the day with it, we're seeing clearly in the distance without the use of glasses, work on pretty much the same principle. And we like to bring out the old model, and we'll do that. And so effectively, the cornea is a very, very powerful lens. It does most of the bending of the light so that it reaches the back of the eye. And so you only require small changes in the curvature here in order to restore focus at the back of the eye here. So laser does it by surgically flattening the eye, and Ortho-K does it through a different means, using a contact lens and using the natural elastic nature of the cornea. And the cornea is basically just a fancy bit of skin. And so you end up basically doing the same thing, flattening the central part of the cornea, which changes the focus at the back of the eye. It's just that the actual method of doing it obviously is different.
So, perhaps there are some risks or some side effects that come along with LASIK that you don't experience if you do choose Ortho-K. Is that a correct statement?
Yeah, look, any surgery has its risks, and if we're going to be fair, any contact lens wear, and Ortho-K is a special type of contact lens. You've got to be mindful around infection risk. So you've got to compare those kind of two things. A lot of the time, infection risk is a lot of it's in your own hands at doing all the right things. Surgical risk is a little less in your control. It's in the control of the environment that you're having the surgery done and the surgeon. There are, from my observation, some challenges with the higher prescriptions in laser surgery. That's typically where I might see some of the progression, and the research seems to support that once you get up into very high degrees of myopia, then the laser surgery, you can get progression. And equally, you've got to be an experienced Ortho-K practitioner to be able to fit high degrees of myopia. We can certainly do it. It's probably not as routine as some of the lower amounts. As far as the comparisons go, people are often getting Ortho-Ks. They might experience dry eye with regular daytime contact lenses. And so we're providing the benefit of restoring their sight without glasses and avoiding the issue of increasing dry eye symptoms at the same time.
And I think it's probably not a huge risk factor, but I understand that with traditional LASIK, at least, if let's say, you're somebody who does martial arts or combat sports or something like that, there is a risk of what they call flap dislocation with the LASIK, which of course is not an issue if you're using Ortho-K.
That's right. I mean, you get a finger in the eye, and which can happen easily in martial arts. Then that is one of the risk factors. And obviously, look, you can still get a finger around the eye, regardless of wearing glasses, contact lenses, or Ortho-K. But you've got a much more tightly stitched together cornea. We're not actually disrupting the sort of structure of the cornea. We're kind of just taking advantage of the elastic nature of that specialized piece of skin.
All right. Well, talking about lifestyle advantages then for adults. So, I guess there are a lot of ways that Ortho-K can benefit people who are looking to get out of glasses. Like, for one thing, like, it's not something I have a lot of experience with personally, but for ladies and people who use makeup, that's the fact that you're not actually having to put contact lenses in before you apply makeup. That must be a big advantage.
Yeah, absolutely. So, you're effectively dealing with the vision correction at a convenient part of the day. You're putting these lenses in just before you go to bed. You go to sleep, you wake up, you wash your hands, you take them out, and then you just get on with your day. You're seeing clearly, and there's no more fuss, other than just once you take them out, you need to clean them, but that's not an arduous task.
Right. And I guess, if you're somebody who enjoys water sports, if you're into surfing, even swimming, it's not a good idea to wear traditional contact lenses while you are in the water. So is that something else that you think is in the plus column for Ortho-K?
Yeah, so I mean, if you have a look at what are the risks of going in doing a water activity with a contact lens, is the contact lens has a way of attracting and having the bacteria or the other bugs that create or increase your risk of infections kind of stick to the contact lens, and so they're being held there. And so there's more opportunity for that bacteria or that bug or bacteria or germ to actually create an infection. Obviously, with Ortho-K, you don't have something in your eye, so you're not attracting extra. You don't have something there that's going to hang on to those pathogens.
Yeah, there's some pretty nasty like parasites, I think, that can be introduced by wearing contact lenses in water.
Yeah,
Okay.
Acanthamoeba is the big one that we worry about with water introduction, and that's something we counsel people on with their Ortho-K lenses. You need to make sure that you're not sort of using water with your Ortho-K lens, that you're using the appropriate products. But yeah, we have the advantage of you're not wearing them while you're doing a water activity.
So are there any types of like professions or job roles where you think Ortho-K might be a good option? Like I'm thinking, maybe people who are working in dusty or windy environments where, traditional contact lenses, there would be additional challenges there.
Yeah, and that's the challenge of contact lens, where that like attracting pathogens while you're in water with them on, you can get dust and those sorts of things caught underneath them in those sort of dusty environments.
So for people who, have had problems with dry eyes in the past, so Ortho-K would be a good option for them, you think?
Yeah, so if you're someone where your dryness symptoms mostly only occur when you put a contact lens on, that puts you in that kind of borderline dry eye category. And so we're assuming that if we've looked at your eye and your cornea is intact and we're not seeing sort of active major issues with dry eye we need to resolve, you don't get those contact lens related dryness symptoms with an Ortho-K lens, because you're going to be asleep while you're wearing it.
That's right. Okay, well, so we've been talking about Ortho-K for adults, but it's kind of ironic, I think, that although orthokeratology was maybe originally experimented with as an adult vision solution, there is a lot of clinical evidence now that it's a really good option for reducing myopia with children, isn't it?
Yeah, look, it's considered one of the top, in because it's got so much research behind it. It was one of the treatments that really led the charge in myopia control. And being a relatively early adopter, I remember the local orthokeratology sort of society. There was probably less than a hundred of us in Australia and New Zealand practicing in that way. And at that time, it was, as you said, mostly an adult correction that was marketed as an alternative to laser surgery, an alternative to daytime contact lenses, and obviously an alternative to wearing glasses. And as we all gained more experience and the industry was able to help us provide faster results, more consistent results, then we got more comfortable fitting younger people with it. And then a lot of the practitioners were sort of observing and saying, hey, you noticed that the young people that we fit this with their prescriptions don't change nearly as much as when they were in regular contact lenses and regular glasses. And that caught the interest of local researchers. And so a big part of what we see in the world now for myopia research was really driven out of Australia, and Ortho-K was right there at the beginning, in the early part of that. And so it remains one of the best researched. If you have a look at from a myopia control point of view, there are a lot of ones that are all on an even par, but Ortho-K just happens to have the test of time.
So
And if you look at any adjunct therapy where you might be using multiple therapies to really, if someone who is a rapid progressor and you're wanting to sort of double up the treatment, so you're using two different strategies, then Ortho-K is one of the ones with the strongest adjunct therapy research behind it. It's front and center. So you're doing Ortho-K plus you're doing something else.
are you talking about, for example, like atropine drops, are you?
Yeah, and red light therapy now, which is something, as we were speaking earlier off camera, that we're introducing into the practice very, very soon. And so there's a very strong result when you use it as an adjunct therapy with Ortho-K.
Okay. Well, maybe watch this space on that one, I think, because I think you probably want to talk more about that next time in the near
Yeah.
future.
Yep, just need to get a little bit more seat of the pants experience with it and get all our protocols in place. But yes, no, it's an exciting time to be able to introduce that in addition to the Ortho-K that we're already offering.
So speaking about Ortho-K for myopia control, like Is there any sort of age range for kids where you think Ortho-K is a viable option?
Yeah, look, if we talk about, and you've got to be careful, we don't want to be over promising stuff, but I mean, the youngest that I've had in Ortho-K is around that 6 or 7 year old mark. That takes and if we talk about contact lenses in general and include Ortho-K in that, it requires a reasonable bit of motivation, certainly at younger ages, to get that done. And so, certainly by the time we're talking 10, 11, 12 years old, it becomes more common to use it in those sort of older age groups, but certainly down to sort of 7 or 8 is possible. Just depends, if we've just got to be selective, and the family and the patient's got to be willing and ready to kind of participate in it. But, so there's not a strict age limit. And if you look at contact lens wear, again, being Ortho-K being a particular type of that, then, the previous research has demonstrated that kids can be good contact lens wearers, and so the age is not necessarily a barrier to that.
So it sounds like it's really just a case of whether the children are mature enough to use contact lenses responsibly, or they have the right kind of parental supervision.
Yeah, and look, it can be a little daunting for anyone to have something placed on their eye for the first time, and so it's also negotiating that first step as well, and being able to sort of move past. It's only a short window of time, but it can be a big occasion for some people having something put on the eye, and so that's something we need to negotiate. And then obviously, older kids, you can have a deeper conversation about the goals and why we're doing it.
All right. Well, so if you're watching this and you found this content to be valuable so far, don't forget to hit the like button, because it really helps us out with the YouTube algorithm and also helps other people to discover this information. We'd really appreciate it. So, all right. Well, how long does it typically take a patient starting with OK? How long does it typically take them to start to see the benefits of this approach?
Yeah, well, I guess it's probably a good time to talk about the process. So when we have someone who might be interested in Ortho-K, or we're introducing to someone who's a potential candidate, we're looking at, first of all, what's their prescription like. We do use a topographer, which maps the eye shape. So we're getting a sense of their suitability to the treatment. We're obviously going to be talking to them about their goals and what their expectations are, and making sure those sorts of things match. Being a contact lens, we talk about hygiene and managing infection risk. So once we get past that stage, then we do a fitting process. So it is a custom-made lens. So we use some lenses that we call trial lenses to match the information we're getting from our instruments to the actual eye. That also allows the person to get some experience. Now, a lot of the time, the trial lenses that we're using, that they get to use sort of overnight, can be fairly closely matched to the final lens that you're going to get. So, if we fast forward to when you've actually got your actual lens, you're looking at sort of 50 to 70% of your prescription out on the first night. The research done some time ago sort of indicated that across different designs of Ortho-K, you're looking at sort of hitting your maximum daytime vision on average by 2 weeks. And I certainly think that clinically we're seeing that, since that research has been done, more efficient strategies. I feel like we're sort of seeing that more like by the end of the week, you're getting good daytime vision. It might be little things like about your night vision that we're still troubleshooting. And so there's a little bit of a fitting process to initially order the lens. So it might be a couple of weeks of trialing. But once you've actually got your lenses, then you're talking a week or two and you're on your way. Bearing that some cases we might have to fine tune the lens and the fit, but typically you're seeing well enough in that time that for the majority of people, it's just fine tuning.
And so, like, I've got personal experience only with soft contact lenses, but Ortho-K lenses are the rigid variety, aren't they? So does it take people a while to sort of adjust to that sensation?
Yeah, absolutely. So you feel it a bit more on your eyelid. Back when rigid lenses were mostly used for daytime wear, I remember one of my and prior some of the earlier versions of soft lenses not being the healthiest things around. One of my mentors used to quip that hard lenses were hard on you mentally in the first couple of days, but soft on your eyes because we had very low complication rates with daytime hard lenses. Whereas soft lenses were soft on you mentally, but hard on the long term on your eyes. And so, yes, there's a little bit of eyelid awareness, but again, most of that comes from the eyelid moving over the lens. And so I say to people, look, put your lens on, close your eye. What should happen is most of the sensation should go away. It's not going to keep you awake. And once you've worn them a few times in a row, that sensation gets less and less and less. And when I do a review with my long-term Ortho-K wearers, and even some of the ones in the short-termers, what do you notice about them? Oh, they're fine. They don't bother them. They're not bothered by sleeping. Some people can read for a little, sort of half an hour or so while I've got them in before they nod off. So it's a very short-term issue.
How do they actually compare in size with like the old school rigid lenses? Are Ortho-K lenses the same size, or are they a little bit bigger? Or what's the difference there?
Typically a little bit bigger. So if you look at soft lenses are typically around the 14 millimeter diameter. Traditional rigid lenses daytimes were probably more like 9 millimeters. I would probably, in a rare instance, fit a 10 millimeter Ortho-K lens, but most of them are going to be sort of 10.5 to 11.5 millimeters in size. So they cover pretty much the cornea sits over your iris. And so if you look at the visible iris color, most people fit within about 11 to 12 mils, and the Ortho-K lens fills that cornea effectively. And which makes them a little bit more comfortable than traditional rigid lenses because they don't move as much.
Well, another type of like special contact lenses is scleral lenses, which fit over the whole cornea. And I
Yes.
think with scleral lenses, a lot of people use special tools maybe to insert or remove. Is anything like
Absolutely.
that? Is anything like that required for Ortho-K, or you can pretty much just do it with your fingers?
But where I can, I do prefer people just use their hands to take Ortho-K lenses on and off, put them on and take them off. At least initially, it can be a little daunting, or if some of the finer motor skills are a little bit more challenging, we might use a little suction device for removal. It's just another thing to keep clean and look after and replace. So at some stage, my preference is to be able to teach them how to take them off without doing that.
And what's the cleaning and maintenance process at night? Like how long would that take? And like what do people need to do with their lenses to keep them
Yeah,
healthy,
so
to keep
you
them in
do
good
need to
shape?
use what we call a soaking solution. So after you've worn the lens, so the process I say to people, you wash your hands, take the lens out. You're going to use a solution that you rub it in. So you're going to gently rub the lens for about 20 seconds each, 20 to 30 seconds each side. You're going to rinse that off, and then you're going to pop them in a case with a soaking solution, which has a low concentration of a disinfecting chemical effectively that works across the day to clean the lenses. That evening, you're going to wash your hands, you're going to take them out of the case, you're going to tip that solution out, you're going to rinse it with a sterile saline. And in my practice, we use that same sterile saline to put in the back of the lens to put on in front of your eye. So you've got that cushion of a comfortable liquid that goes on with the lens. And then we get them to do a protein clean once a week, which is an intensive clean.
Okay.
Because these are a lens that you're not replacing. It's not like a daily soft lens where we're getting a new lens each day. This is a lens that you're having to hang on to for 12 months up to 2 years.
Okay, well, that's a really good segue to my next question, which is about the cost comparison of Ortho-K to maybe other solutions like daily disposables. So, like in general terms, like what could people expect to pay?
It's
I
probably a
guess.
little bit more, it's more upfront than wearing regular contact lenses, but if you kind of space it out over, a sort of 2 to 4 year period, you're probably fairly even Steven by the time you look at, particularly if you're comparing it to single use or one day lenses, the most common now. And if you're using a high quality single use brand, then you are easily spending the same sort of money, if not more than what you would be with an Ortho-K lens over the longer term.
And do you think people need to have a backup pair of Ortho-Ks, or is it generally if people just have the one pair?
I guess because just that upfront cost, look, if you're traveling a lot, I do suggest that's a good idea. You can often get away with a backup using glasses, and some people do soft contact lenses, depending on their tolerance of the soft contact lens. So there's a number of different ways you can sort of do a backup, but certainly if you're traveling or you'd be lost without it, then a second pair is not a bad idea.
And with Ortho-K, do you check that people's prescription is pretty stable before you fit them with a pair, or is that really not an issue in the same way that it could be like with LASIK, for example?
Yeah, look, and it's kind of the one of the requirements of laser surgery is that you've got at least 12 months of stability before you're considered a candidate. And with Ortho-K, I mean, we're using it to create stability and try and slow down those changes. So it's absolutely not a reason. In fact, if someone is progressing in the myopia, that would be a stronger argument for using some sort of myopia control. And as we've discussed earlier, Ortho-K fits perfectly into that. So that would be a big green light to kind of really consider this as an option.
Mm. Now, not every optometrist does Ortho-K, and I think there are some like there's some special equipment that you need to do it. So, like, what should people look for, you think, when they're choosing a practitioner to do Ortho-K? Like, for example, are there any professional organizations that practitioners like yourself can become certified with?
Yeah, look, each manufacturer will have their own sort of certification process in order to use their design. So a lot of the certificates on the wall might be for individual sort of certifications. But as far as it is great if someone is a member of at least Australian Contact Lens Society. I think it's called the Cornea and Contact Lens Society of Australia now. The one that's dedicated to Ortho-K is the Orthokeratology Society of Oceania. And often being a member is enough of those. You can get additional certification and become a fellow. I have not gone through that process, but I've got 20 or 30 years of experience to sort of back myself up that I haven't gone down that path at this stage. And I know the vast majority of people in those organizations are just members, and they're all very good, experienced Ortho-K practitioners.
And like what type of diagnostic tools would an experienced Ortho-K practitioner typically have in their clinic?
In addition to the regular setup, probably the key one is that they need to have a corneal topographer, which is a particular instrument designed for getting very accurate measurements of the eye shape. So not only does it allow you to understand what challenges you might meet with a particular patient before you start with an Ortho-K lens, that helps you choose which design is going to work best. It might help you predict their suitability and success rate. But it's a vital piece of equipment for making sure that the lens is fitting well at each visit. And if you are someone who's using Ortho-K as a myopia control tool, then the increasingly strong advice is that you have some sort of way of measuring axial length, not just prescription, as a way of monitoring your success at slowing down progression in myopia, because the primary sort of parameter now that's being monitored for myopia control success is axial length. And so just over each shoulder, over this shoulder is my OCT, which does biometry, so it measures axial length, and over the other shoulder we can just see my corneal topographer there. And so they're the two probably vital bits of equipment now in modern Ortho-K practice, in addition to having trial sets. I mean, I've got a number of different trial sets so that we can move between and choose what we think is going to be a best match for a particular patient, particularly when you start getting into, do they also have astigmatism with it? Is it someone who's actually coming in who's actually long-sighted rather than short-sighted? So there are things around the edges on some people that we can do some different prescriptions to what you might have traditionally thought. But that's part of the process of identifying whether someone's a good candidate or not. That's a very much a part of the initial process is making sure that you're suitable, so that it's not a one size fits all approach.
I have actually heard of cases where people have been using like traditional RGP lenses for a while, and maybe the fitting process initially wasn't done well, which has left some sort of long-term scarring. I don't know if scarring is the right word, but in any case, it's perhaps made them not a good candidate for Ortho-K. So, are you really looking for those types of things as well before you sign somebody up for Ortho-K? Are you checking whether there are any, irregularities in their cornea?
No, absolutely. So, coming across a long-term rigid lens wearer is a lot rarer now. Someone who's wearing a rigid lens more long-term now may have some other sort of eye disease like keratoconus, or some sort of other irregularity that we might be a little bit more concerned about. And there's some conjecture around whether you should be fitting someone with keratoconus with Ortho-K or not. I tend to avoid it until we know more about it. Perhaps with some cross-linking, some co-management with an eye specialist who specializes in cross-linking, maybe that's something that will emerge. But at this stage, yeah, no, that's part of a careful check, is making sure that the cornea is intact, making sure there's no dystrophy there that's going to preclude them or put them at a higher risk of an infection.
All right. Well, so we might wrap up there. I think, Paul, any last thoughts before we do?
No, I think we just want to assure people that, Ortho-K has been around for a very long time. In fact, the original concept, I call it a bit of a Leonardo da Vinci moment. They were talking about it in the 60s. And the reason I call it about a Leonardo da Vinci moment is he created all these wonderful inventions that he couldn't make. And so Ortho-K was one of those things that they observed changes in people wearing regular lenses where they could spend part of the day without the lens and still see clearly. And so they went down through a process of discovering how it might work. And one of the pioneers of it drew a profile and said, this is the lens we need to make, but we can't make it yet, because their lathes just didn't have the accuracy. And it really sort of took another 20 or 30 years before computerized technology, just a degree of accuracy in lathes kind of caught up to a point where we could start into it again. So it has actually stood the test of time. It's been around for a very long time. I mean, it's been in my practice. We've been going for over 20 years, and I can tell you that it was in Australia probably a decade before that. So I just want people to trust that it has been around a long time. It's not a new thing. And while healthy skepticism is good, trust that it's not too good to be true. It is a genuine, bona fide treatment that's available to lots of people, particularly in first world countries like Australia.
So it's not a fad like hula hoops and yo-yos. Then it's been around for a while.
It's been around for a while. Yeah.
All right. So can you just remind people how to get in touch with you there at Harmony Vision Care?
So you can go to harmonyvisioncare.com.au. We have a Facebook page as well under the same name, Harmony Vision Optometry and Vision Therapy Clinic. Our phone number is 0755205900. But if you go to the website, harmonyvisioncare.com.au, you can contact us through that. There's also a bunch of additional information. You can look up Ortho-K, myopia control, and a lot of the other services that we do.
Right, and once again, don't forget to hit the like button and subscribe to the channel. Subscribe to the YouTube channel if you want to be notified when Paul releases more highly valuable YouTube videos such as this one. And also, please follow Paul's Facebook business page and Instagram to see him post updates on the latest news, promotions, and events at Varsity Lakes Practice. So I've had an inside tip that there might be an unboxing video coming soon. I'm not sure about that. All right. Well, thanks a lot, Paul. And until the next video, everyone, have a great day.
Great. Thank you.
All right. Bye-bye.